Morning.
Hi everyone.
No one there.
That's okay. Archie's coming over to say hi. Hi everyone, my name's Robin and this is Sean, and today we are going to be covering what is in our first aid box and fractures and broken bones. Last week we did burns. What else did we do last week? Burns and
recovery position.
yeah, and the week before we did CPR as well. So if you're tuning in, we want to know where you are, how old you are, and your name. We'd love to know. Yeah.
Two people watching, who do you reckon? Silas and Rory.
Definitely.
Alright, so last week we talked about burns, and we're going to do a little bit of a recap and see if you can remember
what we taught you.
taught you. There's 4 stages when dealing with a burn. So if you want to comment if you remember any of these stages, and what we will do, are we going to wait? Here we got Ailey.
Ailey from Edinburgh.
Hi Ailey.
Nurse Rianne is watching.
So if you were watching last week, Ailey, do you remember any of the 4 stages to the treatment for burns?
Alright.
I will go through them all slowly, so if you do remember, then you can pop one up. So the first stage in our treatment for burns is we want to remove any jewellery or any clothing if possible. If the clothing is stuck to the burn, we're going to leave it on there. But the reason why we remove any jewellery is because burns swell. So burns will become larger, and if I burn my arm and I'm wearing a watch, or if I burn my hand and I'm wearing a ring, that area is going to swell, restricting the blood flow from getting to my hand or to my finger. So that is the first step. Remove any jewellery or any clothing. Robin, have you got any?
We've got Silas and Rory.
Silas and Rory are back.
Elliot and Bolton. We've got the Moore family in Melbourne.
Bolton, wow. Hello from the Moore family.
All the way from Melbourne.
Who have we got?
We've got
home of the Melbourne Stream Traction Engine Club. Wow.
Alright, okay.
Okay, so the second thing that we have is cold or cool running water. Now, how long do we run that cool running water on that burned area? Silas and Rory, I'm expecting an answer from you. So I burnt my arm. Say I burn my arm this area here, I'm going to put the cool running water just above, allowing it to roll down across the burned area. And this is the most important, Rianne, yeah, you can answer. This is the most important step in the sequence because this will halt the burning process. 20 minutes, yes.
Elliot.
Well done. So 20 minutes, we're going to run that cool running water on the burn for 20 minutes to halt that burn. The next thing that we do is we wrap the burn. Before I show you the picture, can anybody remember what we wrap the burn in? 20 minutes, yet we're getting all the answers coming in. Donna, Elizabeth.
Hi Kyle and Cameron. All the way from Dundee.
From Dundee. So next thing we do is we wrap the burn, but we don't want to wrap it in something like this. We don't want to wrap it in a sticky bandage. What do we use to wrap the burn? If you send your comments now, here we go.
Elliot,
Cling film. Well done. Yeah, pop your name after your answer. Elliot, well done. Cling film, yeah, we're getting all the answers. So it's cling film. So cling film is not going to stick to the burn. So when I get up to hospital, I need to get checked out. It's easily going to be removed and take it off. And what I do when I wrap it around, I scrunch in the middle, and that way when my arm swells, it gives the cling film room to go into. And the last step, step 4. Elliot, do you have an answer for this one? Where should I go if I burn myself? If I'm a child and I burn myself, it's a bad burn, where should I go? As your answers come in, there's a little bit of a delay, so I will show you the next one. Wait for your answers. Where am I going to go if I burn myself and it's bad? I'm going to go to the hospital. I might need some advanced medical treatment at hospital if it's a bad burn. in their best place to do that for me. And what have we got? Elliot, killing it. Well done, buddy. Hospital, yes, you remembered everything. So that's a little bit of a recap. I'll just run through all 4 stages.
Well
a little
done,
bit of a recap from last week. So we have remove jewellery or any clothing that is not stuck to the burn. Cool running water for 20 minutes. We got that answer. Wrap it in cling film. It's non-stick and it will protect the burned area without sticking to the injury. And the last thing is consider hospital treatment. If you're a child, I would say go to hospital. If it's an adult, let them decide. They'll know if they need hospital treatment or not.
Alright, so we're going to move on to a new topic today. So we're going to talk about a first aid box. Do you have a first aid box at home?
I've done, Cameron.
If you do, where is it? Maybe you don't have a first aid box at home. Maybe it's a drawer of stuff that your parents have just collected all the items that they would need in an emergency, and that's completely fine. If you have time, we're going to give you a little bit of homework, and that is to go through your own first aid box with an adult at home or that drawer of stuff or cabinet, and just make yourself familiar with what we have. So first aid boxes can look a little bit different. We've got the classic one here, which you probably will have seen at schools or workplaces, and then we have this one here. So they all look completely different, but they all have the same idea. What kind of things do you think might be inside our first aid box? We're going to take a little look through and go through some of the stuff and then how to use them. Kitchen cupboard above the sink.
Yeah, Silas has one for scouts, that's good. I sometimes do it to myself. Elliot, yeah, good.
Actually, he's off. Alright, so we're going to take a little bit of a look through our first aid box, but yeah, we want to know where your first aid box is.
So why don't you start to comment what is inside your first aid box? What kind of items might we find in your first aid box? Arlene, Elliot, Silas, Rory, Paul Laird, tell me what is in your first aid box. Oh, Ryan Kay's back.
Right, let's start to go through it. So the first thing we have is plasters. There's no plasters in there. So plasters is the first one. Here we go. And we can use these for small cuts. We're going to do bandages and bleeding and stuff another week, but that's what we would use them for a small cut. I'm pretty sure you will all have had a plaster on at some point. The next thing we have is different bandages. So this bandage here is what we call a roller bandage, and you can use this if the cut is quite large and the plaster is not going to be big enough for it. We've got bandages, clean and spray, clean for the greys. Yours is under the sink in the laundry cupboard. All right. So we've got bandages, we've got plasters. Here's a different bandage. So this is our triangular bandage. We're going to use one of these later. We also have, this is our little ice pack here, so you can pop this in the freezer or the fridge. And this is good for any potential bruises, and it's also good for if you bump your head. Pop it on and it helps take a little bit of the swelling down too. You might not look like this, it might look completely different, but if it's cold, it'll do the same thing.
Pretty interesting, right?
Then you might have some creams or ointments. So this is an antiseptic cream. A lot of people have used this when they were a baby.
Elliot, that's a really good answer. A lot of people forget about that one, and we do have that. Robin's got it right now.
What?
Tinfoil blanket.
Alright, so the next one is this tin foil blanket here. So it's shiny and it's foil. I'm not going to open it right out because then I'll never be able to get it back in again. This is it here. So these are good especially to have in your car and when you're out and about in an emergency, because if you're, say maybe someone's been in a car crash, for example, and it's raining and they have to wait at the side of the road because it's not safe for them to wait in the car. If they have one of these foil bandages, foil blankets, you can wrap yourself in it and it helps keep someone warm. Or if you're outside and someone's collapsed and they're lying on the ground, it's going to be cold for them. But if you wrap them up in this foil blanket, it helps keep any of the heat in for them. So these are good to have.
Somebody said contents list. Very smart.
Nice. That's
very
a good
smart.
one.
And
We then have some sterile swabs or gauze. So open it up so you can have a look at this one. So this is what it looks like in here. So again, you can use this for a cut. It's clean. You can put lots of pressure on it, and then you can pop your plaster or your bandage on.
And it could come as a circular bandage and use it as an iPad.
You want to do some?
No, you keep going.
We also have these.
Cream ice pack, yes.
So this is our gloves. So these are good, especially if you're doing a first aid where there's cuts and there's blood. We want to make sure that our casualty is as clean as possible and that we stay as safe as possible as well, because we don't want any germs. We will be covering cuts and bleeding another week where we go into a little bit more detail, but these are definitely good to help keep everyone clean and safe. How about this one? Has anyone had to use this one before? Sean's going to demonstrate what it's for.
Every Sunday morning, Saturday night.
It's a sick bag. So these are good, especially in the back of car. If you get car sick, they're good to have for vomit, or you might have seen them in planes as well. We also have scissors. So the scissors are in our first aid box for helping cut up any bandages. We have this one here. So this is an eye wash. This is good if you've got something in your eye to help clean it out. Now you can use tap water as well, and that's completely fine to use, but it can be quite hard to get your eye underneath the tap. So sometimes these are easier to access and get an adult to help you clean that eye out. We also have safety pins. So these safety pins are good for bandages to help you keep it in place. And the last one we have is this one here. So this is a thermometer. And this is, you probably had to use it before, an adult might have helped you, and it's to check your temperature, because when you're feeling sick, your temperature can shoot up and you might have a fever. So this is to help check how hot you are. So this is a thermometer.
How many of those items match what's in your first aid box? So have a look through your one, send us a comment, let us know if there's anything that you do have, if there's anything that we have that you're missing. So there's no right or wrong answer as to what you have in your first aid box, but these would all be helpful tools in a first aid emergency.
So moving on to fractures. So the first thing is fractures and broken bones. They're both the same things. So while we start to discuss them, we want to hear about yours. Who's broken a bone? What did you break and how did you break it? Sean, you've broken a few bones?
Yeah, I've broken, you're missing scissors. Yeah, so scissors could go in there. Back to my broken bones, I broke my arm when I was younger, fell over and broke my arm. I think I broke my other arm as well, so I've broke 2 bones in my lifetime. And yeah, let us know what bones you've broken. On average, you will break 2 bones in your lifetime. That's good news for me.
I've only broke one, so I might have another one to
Bad
break,
news
maybe.
for Robin.
So there are 4 main different types of breaks. We have a closed fracture. So this one here. Pretend this is an arm. This fracture, the bone has stayed within the skin. So this is the most common one, is a closed fracture.
When I was 2, fell off the sofa, ouch.
So the opposite to a closed fracture would be an open fracture. So this one here, what's happened is when the bone has broken, it's starting to stick through the skin. So you can actually see that coming out the skin in the arm. So that's an open fracture. You then have a complicated fracture. So what's happened is a bone has broken and then there's something stuck in between it, like a vein or an artery, Or it might be that maybe a rib's broken and it's puncturing a lung, so it's causing further complications. So this one's a little bit trickier to deal with. And then the last one, this is really common for children in particular. This is called a green stick fracture. So you can see the bone's been broken, but it's not gone the whole way through. So because children have got bendier bones than adults, when they fall and they put their hands out to stop themselves from falling, this green stick fracture happens quite a lot. So they have broken a bone, but it's just not gone completely all the way through. So we have open, closed, complicated, and green stick. So we're going to discuss the signs and symptoms of fractures and broken bones. So if you have broken a bone, there might be deformity. So that means it's a different shape to how it normally is. Maybe there's swelling. Maybe you can't put any weight on it. Maybe you can't move it properly. So if you've maybe broken your arm, it doesn't feel right and you can't move it how you normally would. There might be bleeding if it's an open fracture. So if the bone's poking out through the skin, then there will be blood as well. You might actually not have any pain. It really depends on the type of fracture. So my little brother broke his hand last year and he was going around with his knuckle hanging down here for a few weeks before he went and got it seen to, and it turned out that he had broken his hand, but he didn't have any pain at all. But normally there would be a little bit of pain. You might also hear it crack as well. That would be an indication that it definitely is broken. Anything else?
Swelling, bruising, pain.
Yep, done it all.
Popping noise.
Yeah.
Did that one.
Yep. So that's how you can potentially tell that you have had a fracture. Now, how are we going to treat it? So the first thing is, if you suspect that there's a broken bone, you want to keep it as still as possible. So if you've maybe broken your leg or your ankle, we don't want to be walking around and moving on it. So stay as still as you can. From there, the next thing you want to do is try your best to support it. So we're going to teach you a couple of different slings that you can do for broken arms. So have your bandage at the ready. We're going to move on to that in a minute. You might need to bandage up legs if it is a broken leg. However, if you just want to stay as still as possible, it might just be an idea that you just want to wait on the ambulance and don't put any bandages on it, because you can cause someone a lot more discomfort and pain. But say for example it happens when you're maybe on a big hill walk and an ambulance can't get to you, then you would need to bandage it up in the meantime. For every suspect broken bone fracture, you do need to go to hospital every single time. Now, it's quite hard to tell if you do have a broken bone because the signs and symptoms are very similar to sprains and strains. So you will have to get an x-ray at the hospital and they will tell you if that bone has been broken or not. After that, if it is broken, they will pop it in a cast for you. So I don't know if you're doing Joe Wicks's PE sessions, but he's got his cast. He's got a blue one. You can pick a colour and you can get your friends to sign it as well if you're allowed. But that is the treatment for broken bones. Now, every single time we're going to go to hospital, if it's a broken arm or hand or something not quite as serious as a leg, you can get an adult to take you up to the hospital. So you can sit in the back of the car safely and be transported up. But we would advise every suspect broken leg, it's a good idea to wait on an ambulance because it's quite hard to get into a car and potentially get into a car seat safely. And also the person who's driving is going to be really worried about you, which means they're not going to be focusing on the road properly. But if it's a broken leg and the paramedics come, remember that's people who work in an ambulance, they can take you out on a stretcher safely without having to move that broken leg too much and keep it as immobile as possible. So we are going to do 2 different slings today. So if you've got your scarf or your bandage or whatever it is that you're using today, here is our triangular bandage. Yeah, sure. We have got 2 different slings that we're going to do. I'm just going to tie my hair up so it gets out the way. For Sean.
So if you have one of these triangular bandages, that's great. You will notice that one of the sides is a right angle. So this side here is a right angle. That is the side that goes to the elbow. Always goes to the elbow, so that's the easy way to remember. And we'll show you what you can do if you don't have one of these, what you can use, your scarf, your hoodie, whatever it might be.
So we are going to do two slings. The first one is a support sling. So when it's a support sling, the arm is here, where it's very low. And then when we do an elevation sling, that is when the arm comes all the way up to the shoulder here. So we're going to start off with the support one. So if the casualty can have your hand like this, our rescuer is going to get going with the bandage.
You can use anything, tablecloth, any kind of fabric that if it's a square, just fold it in half so it then becomes a triangle. So what I do with this one, I have the right angle at the elbow, I go under the arm, this piece goes over the shoulder, and the other corner that's down on the floor comes up and over, and then all we do is tie it off. And if you drop your arm down, if you want to do a fancy knot, I know that you said that some of you were at Scouts, so you might have learned some fancy knot. I just double knot it, tie it off, and as long as that weight supports the arm, that's all you need. So take a little photo when you've done that one. Do you want me to show you again? Because it was pretty quick.
Do it one more time. Now if you're using a scarf and it's hard for you to tie a knot in it, now would be a good time if you have safety pins to use them to hold it into place like that. Tied it too tight.
Okay, so I'll show you that one again. This is a support sling. I'll ask you at the end the two names, so try and remember. Right angle in my right hand goes under the arm, and that stays at the elbow. This side comes over the shoulder. Pick this one up off the floor, over the other shoulder, and then tie it off. Drop your weight down, and there we have it. So I will leave you to give that one a shot, and in the meantime, what I'll do, show you how we can use a hoodie. So if I have a hoodie, I can roll up my hoodie, place my arm into it, and there I have the support in my hoodie. And what else I can do, if I have a zip up hoodie, zip it up halfway, arm inside, and I can support my arm that way also. So there's a few different things that we can use. If it's a scarf, just tie a loop, hand in the loop, and there we go.
So anything that's going to hold it and keep it in place will work. So that was the support sling. Now we're going to do the elevation sling. So this is when the arm comes up high. So on you go.
So the right angle still goes to the elbow. This time I'm going to go over the top rather than going underneath. I'm going to bring this side under the elbow, tie it off at the back. What I can do is ask my casualty to hold that in place. Tie it off at the back.
Why turn around so they can see it at the back?
Yeah, sure. So it kind of goes across the body diagonally. And then at this corner, we have this excess sling. I twist, 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 and tuck it in. And then if I want, I can just encase my casualty's hand, just for comfort, and you can now drop that down.
There we go.
Alright.
So we do that one more time?
Yeah, we'll do that one again. You can watch back the video as well, because it is probably quite difficult to pick up on everything that we're doing at the speed that we're doing it. So watch the video back a couple of times. It is pretty fun doing the slings.
I think if I take my jumper off, you might be able to see my arm better, because it looks just like lots of black. Alright.
So right angle to the elbow. This time we're going on top. Can you hold it in your hand, please? Over the shoulder. This side comes up and round the back. Tie it off. And then at the end, twist. And tuck it inside.
There we go.
So that was our second kind of sling. Now we told you we're going to ask you the names of the two slings. So if you can comment and let us know the names of the two slings. Silas and Rory are doing it scout style with the neck. Oh, nice.
Oh,
Send us a photo of that.
Yeah, we'd love to see pictures.
What colour is your necktie? Let us know that also.
You can hold it in place. Alright, so we are going to do a quick recap on what we have just learned today. So we're going to ask all the questions, but because there's a delay, if you can just start to answer them and then we'll go through all the answers with you. So get ready, you're going to type in all the answers and let us know that you have been paying attention. So number 1 is name 3 things that are in a first aid box. So any of the stuff that we've pulled out and shown you, I want you to name 3 things that's in the first aid box. Question number 2 is what is a thermometer? So that was the last thing that I pulled out. Can you remember what a thermometer is? Number 3 is why would you use an ice pack, or when would you use an ice pack? What would you use it for? Number 4 is what were the 4 different types of fractures? So I've got 4 little pictures here. I held them all up and we explained them. So tell us the 4 different types of fractures. We've got answers starting to come in. So well done. Bandages, ice pack and plasters. Perfect. Thermometer. Oh, gloves. We've got that one too. Eye patch. Nice. And we've got the next answer as well. Okay, so we'll go through them in just a second. Number 5 is what are the signs and symptoms of a fracture? So that what that means is, how do you know someone's maybe got a fracture? How can you tell? How do they feel? How does it look? What did we go over there? Number 6 is how do we treat a broken bone? And then the very last one is what were the 2 different types of slings that we just did? What are they called? So let's have a look at some of the answers here and we'll talk about them. So number 1 is 3 things that we can have in our first aid box. So I did see plasters, bandages, thermometer, ice packs. I've seen lots of different things there. Well done. The next thing is what was a thermometer used for? So I'm not sure, can I scroll? Oh, I can scroll these. Perfect. So what was a thermometer used for? We've got Silas and Rory, they've told us it takes your temperature. Perfect, that's exactly what it does. The next one is, when would you use an ice pack? And Shannon, all the way from Melbourne, she says for bruises. Yes, perfect. And also for bumped heads as well. The next one was the 4 different fractures. Can anyone remember
Silas
them?
And Rory, I think got it. I saw the answer.
Yeah, they've done open, close, complicated and green stick. They've got them all.
Yeah, if you want a job, Silas and Rory, come and give us a shout.
At the end of this isolation, give us a message. We need some more trainers. Number 5 was the signs and symptoms of a fracture. So Elizabeth, we've got you can't move your arm the normal way. We've got bruises, swelling.
What kind of noise might it make?
Pain. Shannon, well done. The snapping noise as well.
Yeah.
Yeah, Avril got complicated green stick and open. Perfect, well done. And then, how do you treat a broken bone? Did anyone get that one? I'm not sure if we got to that one yet. It would hurt. Yeah, Elliot, it would hurt, you're right. So, how do we treat a broken bone? So, stay as still as possible. My mum just tried to call me in the middle of it. Stay as still as possible. And then you need to support it. So, potentially putting a sling on, like what we just did. Then, hospital. So, you get your x-ray and then you can get your cast on as well. And oh, there was one more question. The 2 different types of slings that we just did. Silas wants to be a paramedic. It was support sling and elevation sling. So there were 2 different types of slings. So that's us covered what's in your first aid box and also broken bones. So we would love to see pictures of you guys practicing those slings today and also a little bit of homework. Go through your own first aid box at home, figure out what's in it, or maybe in the drawer of stuff. Have a look at what items that your parents have got in there. Now, next week, I'm super excited for next week. We are going to teach you all how to use a defibrillator. So a defib is the easy way how to say it. So it kind of runs on from our CPR session. So if you didn't watch our CPR session 2 weeks ago, go back and watch that video. And from there, we can teach you how to use a defibrillator. So to make it a little bit more fun, you guys need to have a defibrillator at the ready. So our cardboard one looks like this. Can you hold that? Looks like this one here. So we've got pads, and we have an on and an off button and a shock button. So we want you to make your own defibrillator so that you can follow with us next week. Here's one I made defibrillator. So this was just with some, with some paper and some string. So this is what you need for your defibrillator. So if you can bring it in a little bit closer. So we've got our bit of paper with 2 buttons. So your on and off button is green and your shock button is red. And here are my 2 pads here. So I just got some string and popped them on. So if you can make a little defibrillator for next week, it means that you can follow along with us, and you will either need that soft toy from a couple of weeks ago when you were practicing your CPR, or the other thing is you can use a cushion or a pillow as well. So make yourself a little defibrillator, and then we can go over how to use one, what it does, and why it's so important that everyone knows how to use it. Anything else for today?
No, that's all. Look forward to seeing your defibs next week, see how creative you can get, and we'll see you then.
Yeah, perfect. Have a good week, guys. See you next week. Bye.